So today we want to share with you the importance of prevention. This is something that's been a hallmark of our clinic since we opened almost 21 years ago. Back then in Romania, it was rare for patients to think about prevention. Usually the MO was to go to the dentist when you had pain. And of course the suffering is greater and the costs are greater, and we shared this information with our patients. We shared studies that showed that actually in even countries like Germany, if you don't have a stamp that you were at the dentist for your 6-month checkup, your health insurance won't cover your dental treatments. So it's clear that this is very important cost-wise, but it's also important for the patient's comfort, because if we can treat problems when they're in their early stages, then it's much easier for the patient. So this is something that we put a big emphasis on in educating our patients throughout this whole 2 decades that we've been open.
Usually at a 6-month checkup or at the annual checkup, to this monitoring is added cleaning, which in our clinic is a little bit more comprehensive. The dental cleaning is not only scaling, it is also a treatment with a specific handpiece which is called airflow, and where we do, after that we do professional brushing and a gum treatment with chlorhexamide, which is a disinfectant, which in addition is strengthening your gums, so after you leave they are a little bit more healthy. This is very important because our food supplies and our food habits are a little bit towards stone and tartar deposit. So at least once a year you have to come for a checkup, if not every 6 months. It's very important for everybody to understand that prevention is economizing your health budget. So it lowers the costs of your health budget. I understand very well that dental treatments can have a pretty high fear factor for each individual, but the prevention aspect is assuring that this fear factor gets down to a minimum.
Because we can treat something in its incipient phase before it's developed. So if you think about like a cavity, if you have a cavity that's treated before it gets to the root, then you don't have a root canal treatment, you just get an aesthetic and the cavity can be filled. So it's not as an advanced problem when you are treating something early on.
One of the questions which patients are addressing in our practice, in our clinic, is the fact that after a cleaning, I mean the whole process of this 4 treatments, which scaling is a part of it, after the cleaning your teeth are staying very sensitive. You have to understand that the stone and tartar which is depositing on the surface of your tooth is destroying the enamel. Enamel is the outer layer of your tooth, which is protecting the tooth from big temperature shocks, cold or hot. And once the tartar and stone are removed by the treatment, it is absolutely natural and possible that in some cases, for a couple of days, the tooth remains very sensitive. But it is only during that period when the outer layer, the enamel, is recovering. Once the enamel covered again the whole tooth, then the sensitivity disappears. As a bracket and short explanation, enamel is the only stratus of the tooth which renews all the time. The other layers of your tooth are not renewing, they are staying like that. So if you come more frequent to your 6-month checkup, then This sensitivity step by step goes away because you give me the possibility to clean it earlier, before the damage of the outer layer of your tooth is done.